Hello and welcome to this edition of News for the Hearing Impaired. I'm Rukma and with me is Sonu. Let's begin with the headlines. Leading an all-out war against COVID-19, Prime Minister Narendra Modi chairs task force meet to discuss progress in India's efforts in vaccine development, drug discovery, diagnosis and testing. Over 30 Indian vaccines are in different stages of vaccine development, with few going on to trial stages. Biggest ever evacuation exercise by air and sea begins tomorrow to bring back around 15,000 Indians stranded abroad, 64 flights and 3 naval ships to ferry them back from 13 countries in 7 days. Only asymptomatic passengers allowed to travel. Group of ministers led by Union Health Minister Harshvardhan holds COVID-19 review meeting for 14th time since February, had in-depth deliberation on containment strategy and management aspects of COVID-19, as well as measures being taken by the centre and various states. Centre says no examination to be held for CBSE Class 10 board exams for 2020 nationwide, except for students from Northeast Delhi. JEE mains to be held from 18th to 23rd July, while NEET to be conducted on 26th July. JEE advanced exam to be conducted in August. Major fire reported early morning in Tikri border, PVC market in Delhi. 31 fire tenders pressed into service. No casualty reported so far. Total active cases of COVID-19 in India stand at 31,967. 13,160 have been discharged. 1,583 casualties recorded so far. Coronavirus cases around the world stand at 36 lakhs. More than 2,57,000 have died so far. US reports more than 11 lakh. 80,000 people infected with COVID-19, nearly 69,000 fatalities. And welcome once again. In our top story, Prime Minister Narendra Modi on Tuesday chaired a meeting of the Task Force on Corona Vaccine Development, Drug Discovery, Diagnosis and Testing. The Prime Minister took a detailed review of the current status of India's efforts in vaccine development, drug discovery, diagnosis and testing. Indian vaccine companies are well known for their quality, manufacturing capacity and global presence. Over 30 Indian vaccines are in different stages of corona vaccine development, with a few going on to the trial stages. Similarly, in drug development, 3 approaches are being taken. First, the repurposing of existing drugs. Secondly, the development of new candidate drugs and molecules are being driven by linking high-performance computational approach with laboratory verification. Thirdly, plant extracts and products are being examined for general antiviral properties. In diagnosis and testing, several academic research institutions and startups have developed new tests. The review by the Prime Minister took note of the extraordinary coming together of academia, industry and government, combined with speedy but efficient regulatory process. The PM desired that such coordination and speed should be embedded into a standard operating procedure. He emphasized that what is possible in a crisis should be a part of our routine way of scientific functioning. The Prime Minister suggested that a hackathon be held on this subject, linking computer science to synthesis and testing in the laboratory. The successful candidates from the hackathon could be taken up by startups for further development and scaling up. He added that the innovative and original manner in which Indian scientists from basic to applied sciences have come together with industry is heartening. This kind of pride originality and sense of purpose should dominate our approach going ahead. It is only then that we can be amongst the best in the world and not followers in science. India is all set to bring back Indians wanting to come back home from abroad during the coronavirus pandemic. Standard operating procedures for the world's biggest ever evacuation plan have been worked out. Civil Aviation Minister Hardeep Singh Puri has announced the first phase will commence over 1 week starting from Thursday, under which 64 flights will be operated. List of evacuees has been prepared by Indian missions abroad, and the flights would have reasonable charges. Under the Vande Bharat mission, 64 flights between 14 Indian cities and 12 foreign countries will bring back 14,800 people in the first phase.
Comprehensive plan has been drawn up to address the particular issue of those of our citizens who find themselves distressed and have been stranded in foreign countries. Let me just give you an indication of the number of flights that we are planning to mount during the first week of the resumption or the commencement of this operation. And I mean the period between May 7 to May 13th. We have worked out those details, and these involve 10 flights from the UAE, 2 flights from Qatar, 5 flights from Saudi Arabia, 7 flights from the United Kingdom, 5 flights from Singapore, 7 flights from the United States, 5 flights from Philippines, 7 flights from Bangladesh, 2 flights from Bahrain, 7 flights from Malaysia, 5 flights from Kuwait, and 2 flights from Oman. This brings the total number of flights that will be operated during the first week to 64.
External Affairs Minister Dr. S. Jaishankar also tweeted about Vande Bharat mission in a series of tweets along with images of his efforts together with other officials to coordinate the arrivals during the first phase from the 7th to the 13th of May with the state governments involved. He also urged all Indians stuck abroad and wishing to return home to remain in regular touch with their respective embassies and high commissions. He expressed confidence the collective efforts will make the mission successful. The Indian Navy has also launched Operation Samudra Setu, meaning sea bridge, as a part of the national effort to repatriate Indian citizens from overseas. Indian naval ships Jalshwa and Magar are presently en route to the port of Malé, Republic of the Maldives, to commence evacuation operations from 8th May 2020 as part of Phase 1. The government has been closely monitoring the situation with respect to effect of COVID-19 pandemic on our citizens abroad. The Indian Navy has been directed to make suitable preparations for their evacuation by sea. The Indian mission in the Republic of the Maldives is preparing a list of Indian nationals to be evacuated. A total of 1,000 persons are planned to be evacuated during the first trip. The ships have been suitably provisioned for the evacuation operation. The evacuated personnel would be provided the basic amenities and medical facilities during the sea passage. Stringent protocols have also been stipulated. The evacuated personnel will be disembarked at Kochi and entrusted to the care of state authorities. This operation is being progressed in close coordination with Ministries of Defence, External Affairs, Home Affairs, Health and various other agencies of the Government of India and state governments. Meanwhile, the Home Ministry has issued SOPs for movement of Indian nationals stranded outside the country and also for persons stranded in India who are desirous of travelling abroad for urgent reasons. As per the SOPs, the priority will be given for travel from abroad to compelling cases in distress, including migrant workers who have been laid off, people faced with expiry of short-term visas, those with medical emergency, pregnant women and elderly will also be given priority. The cost of travel will be borne by the travellers. Before boarding, all travellers will be given an undertaking that they will go mandatory institutional quarantine for a minimum period of 14 days on arrival in India. At the time of boarding the flight, all travellers will undergo thermal screening and only asymptomatic travellers will be allowed to board. The passengers will have to register on the Arogya Setu app. During the journey, all passengers will have to follow social distancing and hygiene protocols. On arrival in India, they will be screened and passengers found to be symptomatic will be immediately taken to a medical facility. If they test negative after 14 days, they will be allowed to go home and will undertake self-monitoring of their health for 14 more days as per protocol. The SOPs for persons stranded in India who are desirous of travelling abroad for urgent reasons say that they will have to go to thermal screening and only asymptomatic passengers will be allowed to board the flights. They will also have to follow health protocols. The cost of travel will be borne by the travellers. The 14th meeting of the high-level group of ministers on COVID-19 was held on Tuesday in New Delhi. A detailed presentation on the present status of COVID-19 cases globally and within the country was made to the GOM, chaired by Union Health Minister Dr Harshvardhan. The GOM had in-depth deliberation on containment strategy and management aspects of COVID-19 as well as the measures being taken by the centre and various states. The GOM was apprised that as of now, the death rate is around 3.2%, while recovery rate is more than 25%, which may be taken as a positive effect of the lockdown in the country along with the cluster management and containment strategy. Union Health Minister Dr Harshvardhan held a review meeting to deal with vector-borne diseases such as dengue, malaria, adequate arrangements for testing the disease in hospitals, treatment related to it and other aspects related to these diseases were discussed in the meeting. Dr Harshvardhan said the entire country is busy fighting the corona pandemic. It is also the need of the hour to focus on vector-borne diseases. He said that discussion was held on preparations related to treatment of vector-borne diseases.
वेक्टर बॉर्न डिजीज़ हैं जैसे डेंगी है, चिकनगुनिया है, मलेरिया है, ये तीन विशेष रूप से बीमारियां हैं और इस समय इनके केसेस आने शुरू हो जाते हैं। इनके संदर्भ में जो तैयारियां हैं उनकी समीक्षा की है। कोरोना वायरस के कंट्रोल में पूरी तरह से बिजी रहते इन महत्वपूर्ण विषयों पर ध्यान कहीं बट ना जाए, कैसे सरकार की और गैर सरकारी सारी एजेंसीज़ के बीच में कोऑर्डिनेशन करके रखना है, कैसे लोगों को RWS के माध्यम से इस परिस्थिति में भी इसके बारे में एजुकेट करना है, सेंसिटाइज करना है।
CSIRs, Constituent Lab, Institute of Genomics and Integrative Biology and Tata Sons have signed an MOU for licensing of know-how for FNCAS9 editor-linked uniform detection assay, FELUDA, for rapid diagnosis of COVID-19. The license will include transfer of the knowledge for scaling up the know-how in the form of a kit that can be deployed for COVID-19 testing on the ground as early as the end of May. A completely indigenous scientific invention, FELUDA, for COVID-19 has been designed to mitigate the ongoing COVID situation and cater to mass testing. Its main advantages are its affordability, relative ease of use, and non-dependency on expensive qPCR machines. The technology was conceived and developed at CSIR IGIB under Sickle Cell Mission and utilizes an indigenously developed cutting-edge CRISPR Cas9 technology to specifically recognize COVID-19 sequence in a sample. Active coronavirus cases in the country have gone up to 31,967 as on Tuesday. As many as 13,160 people have been cured or discharged, while 1,583 people have lost their life. According to the Health Ministry, the death rate due to COVID-19 is around 3.2%, while the recovery rate has gone up to 27%. The Hyderabad-based Center for Cellular and Molecular Biology will attempt to grow novel coronavirus in human cell lines, which will enable in vitro testing of potential drugs and vaccines against COVID-19. The research team will use iStem's human lung epithelial cell culture system provided as part of its anti-COVID screening platform to understand the molecular and pathological characteristics of novel coronavirus with a view of establishing a rational basis for testing potential drugs in vitro. According to Rakesh Mishra, Director CCMB, culturing the virus outside the human host is a technological challenge that needs to be overcome. iStem's cell culture system expresses the ACE2 receptor and other genes that are key determinants of viral entry and replication. CCamp is an initiative of the Department of Biotechnology, Ministry of Science and Technology. iStem is working to democratize access to cell therapy as well as disease modeling platforms and bring their benefit to a large section of humanity. Human Resource Development Minister Ramesh Pokhriyal Nishank has announced that joint entrance examination JEE mains to be held from 18th to 23rd July, while the JEE Advanced will be held in August. Interacting with students from across the country, the HRD minister said the dates of these exams will be announced soon. Nishank also said the National Eligibility cum Entrance Test NEET will be held on the 26th of July.
वो हमने तय किया है कि 19 जुलाई 2020 से 23 जुलाई 2020 तक ये जेईई की परीक्षाएं होंगी। 16,84,000 छात्र इस समय नीट की परीक्षा में बैठ रहे हैं। 26 जुलाई को नीट की जो परीक्षा होगी उसके लिए मैं आपको शुभकामनाएं देता हूं।
The HRD minister also informed that no examination will be held for CBSE class 10 for 2020 nationwide except for students from Northeast Delhi. He also said that exams for 12th class will be conducted only for 29 main subjects. The exams were postponed due to the lockdown imposed in the country to combat COVID-19. Prime Minister Narendra Modi had a phone call on Tuesday with Antonio Costa, Prime Minister of Portugal. The two leaders discussed the state of COVID-19 pandemic and the steps being taken by both countries to control its health and economic impact. The Prime Minister commended PM Costa for his effective handling of the crisis. The leaders noted that proactive national measures were helpful in containing the spread of the virus. They offered all possible help to each other in dealing with the situation and agreed to collaborate on research and innovation aimed at fighting COVID-19. The leaders agreed to remain in touch and consult each other on the evolving dimensions of the crisis as well as the post-COVID context. A day after the Maharashtra government relaxed restrictions to allow opening of non-essential shops, including liquor outlets, BMC overruled the order for Mumbai after large crowds violated social distancing norms to check the spread of COVID-19. Liquor shops in Mumbai will remain closed from today, as the Mumbai Municipal Corporation has decided to let only essential services function in the city. Mumbai Municipal Commissioner Praveen Pardeshi issued an order saying that only groceries, medical or chemist shops will be allowed to be opened. The development comes in the back of huge crowds thronging the liquor shops in Mumbai, and huge crowds gathered violating social distancing norms. Two special trains carrying migrant workers left on Tuesday night from Maharashtra's Kalyan station. One train left for Bihar's Patna, while the other left for Andhra Pradesh. All migrants in the train are from Mumbai and adjoining areas, and after completing all procedures, they were brought in buses from Mumbai. Before leaving for Kalyan station, the medical checkup of the migrants was conducted again. All the rules were followed of social distancing, and each train had 1,000 to 1,200 passengers. The detention of former Jammu and Kashmir Chief Minister Mehboob Mufti under the stringent Public Safety Act has been extended by 3 months. The J&K administration has also extended the detention of senior National Conference leader Ali Mohammed Sagar and PDP's Sartaj Madani for 3 months under the Public Safety Act. While Mufti is at present lodged at her official residence, Sagar and Madani are in government accommodation at Gupkar Road. Mufti was initially detained on the 5th of August last year when the centre abrogated the special status of the erstwhile state and divided it into two union territories, Ladakh and Jammu and Kashmir. Later, her 6-month preventive custody was extended by invoking the PSA on February 5th alongside her political rival and former Chief Minister Omar Abdullah. In Delhi, a major fire broke out in Tikri Borders PVC market early this morning. Following the incident, nearly 33 fire tenders rushed to the spot to douse the flames. No casualty or injuries have been reported so far. The government has raised excise duty on petrol by a steep 10 rupees per litre and on diesel by 13 rupees per litre to mobilize revenue collections at a time when global oil prices are extremely low. The revenue generated from these duties will be used for infrastructure and other developmental items of expenditure. Retail sale prices of petrol and diesel will, however, not change on account of this increase in duties. Therefore, it will have no impact on the consumer. In news just coming in Jammu and Kashmir, one terrorist was killed in an encounter at Sharshali Crew area of Avantipora. A joint team of Army and CRPF and police launched cordon and search operation in Sharshali area of Crew. Official sources said that during the operation, a brief exchange of fire took place between the terrorists and government forces. However, as of now, no fresh exchange of fire is being reported. Meanwhile, massive search operation is underway in Beghpura area of Avantipora, which is the native village of top Hizbul commander Riaz Naiku. Since the inception of coronavirus from China's Wuhan, the virus has spiraled and so far has claimed more than 180 countries in its grip. Talking about the infection toll, the total number of confirmed infections has risen to 36,59,759 and 2,57,207 have succumbed to the disease. However, countries adopting lockdowns to prevent the spread. Meanwhile, many countries have extended lockdowns. Others are gearing back to normalcy with the adoption of social distancing measures. In the US, the death toll from the pandemic has surpassed 71,000, with more than 1,203,673 cases of infection. The death toll in the US is the highest in the world. US President Donald Trump has said that the White House coronavirus task force would wind down as the country moves into a second phase of dealing with the aftermath of the outbreak. Paying heed to various scientific reports on the return of COVID-19, Trump termed the pandemic a bad enemy.
We can't keep our country closed for the next 5 years. You know, you could say there might be a recurrence, and there might be, and you know, most doctors or some doctors say that it will happen, and it'll be a flame, and we're going to put the flame out. We've learned a lot. You know, we've learned a lot about the coronavirus. We've learned a lot about this hidden enemy. It's a dangerous enemy. It's a bad enemy.
And the United Kingdom has overtaken Italy to report the highest official death toll from the new coronavirus in Europe. Figures released on Tuesday showed increasing pressure on Prime Minister Boris Johnson over his response to the crisis. Weekly figures from Britain's Office for National Statistics added more than 7,000 deaths in England and Wales in the week to April 24th, raising the total for the UK to 32,313. Only the United States, with a population nearly 5 times greater, has suffered more confirmed fatalities from the virus than Britain, according to data so far. Tuesday's figures are based on death certificate mentions of COVID-19, the disease caused by novel coronavirus, including suspected cases. While different ways of counting make comparisons with other countries difficult, the figure confirmed Britain was among those hit worst by the pandemic that has killed more than 250,000 worldwide. Meanwhile, opposition politicians have said the figures proved the government had been too slow to provide enough protective equipment to hospitals and introduce mass testing. Children have always had a unique way of expressing themselves, and UNICEF Brazil has come up with the Feelings on Paper program to get children to use their creativity to help them deal with the stress and worry over lockdowns amid the coronavirus pandemic. Children came up with a range of colorful emotions, with drawings illustrating sadness, happiness, and the boredom that comes with being stuck inside homes. Brazil is by far the hardest hit nation in Latin America, with 1,14,715 confirmed cases and 7,921 deaths, according to the Health Ministry. And with that, it's a wrap on this edition of the news. News and updates continue on DD News and DD India. Namaskar.